About 1 of 10 Americans suffer from abdominal pain from a hole in their small intestine. We Americans use over-the-counter painkillers, some may drink alcohol, have psychological stress, and/or smoke that promotes the development of ulcers. I feel like that I'm qualified to talk to you about peptic ulcers because I not only have taken prerequisites for nursing, but I've also had my experience with peptic ulcers. Today I would like to inform my audience about peptic ulcers and what they are about. There are many interesting things to know about peptic ulcers, such as what are they, what are the symptoms, and how to prevent them. First, I'm going to talk to you about what exactly peptic ulcers are. There's no clear evidence that a steady diet or fast food causes ulcers in the stomach and small intestines, but they are common in our society. Peptic ulcers are breaks and open sores that develop inside the lining of your stomach and the upper portion of your small intestine. There are also different types of ulcers inside the stomach and the duodenal, inside your stomach and the small intestine. A gastric ulcer occurs on the inside of the stomach, and the duodenal ulcers occur in the inside of your upper portion of your small intestine. A peptic ulcer is formed by a couple different ways. A formation of a peptic ulcer is related to an H. pylori bacteria in the stomach and non-steroidal anti-inflammatory medications that are in 50% of patients. The other 50% are miscellaneous, such as drugs, smoking, and genetic factors. Now that you know a little bit about peptic ulcers, I'm going to tell you what the symptoms are. Peptic ulcers have many symptoms. Depending on how bad the ulcer is, depends on how bad the symptoms are. The most common is a burning sensation from your chest to your navel. The pain will be more intense when your stomach is empty, and it can last from minutes to hours. Other symptoms may include a dull pain in your stomach, bloating, fatty food intolerance, nausea, vomiting, not wanting to eat because the pain is so bad, which leads to weight loss. And pain may improve when you eat, drink, or take certain antacids. Stomach acid makes the pain much worse, and the pain can be relieved by eating certain foods that buffer out the stomach acid, but may also come back later on. But finally, I'm going to tell you about how to prevent some of these and how to treat some of your symptoms. There are many ways about preventing or treating peptic ulcers in different ways. The lifestyle changes, your medical treatments, and different bacteria. The lifestyle changes includes to stop smoking, avoid foods and drinks that give you more symptoms, like makes your symptoms more severe, such as alcohol. Avoid taking too many painkillers such as aspirins and ibuprofens. Avoid foods and drinks that give you more severe symptoms. But the medical treatments are a little bit different. For stomach ulcers, it includes taking tablets to reduce the stomach acid in your stomach, antibiotics to kill the Helicobacter pylori bacteria, and drugs to help heal the ulcer. And sometimes some doctors, they give you a breath test to make sure the H. pylori still isn't in your system after you've taken a bunch of different antibiotics. Now, many people know about the Helicobacter pylori, but to avoid getting that bacteria, it's not hard, but you still need to be aware and take it seriously. People who don't wash their hands could have feces on your hands, or not taking care of food properly, such as not cleaning them or handling your meats differently and not right. It's not clean. And the biggest one is to avoid eating in unsanitary places. In conclusion, I would like to remind you that peptic ulcers may or may not be severe cases, but to always be aware because they are painful. Today I have talked about what peptic ulcers are, what their symptoms are, and how to prevent and treat them. But I still feel like I'm qualified to speak to you about peptic ulcers because I have done thorough research and I've learned about it in microbiology, and I've had peptic ulcers before. Stomach ulcers are a real life problem that no one really knows about until you get them. But now that you know a little bit about peptic ulcers, you may be able to prevent them, or if you know someone that has stomach ulcers, this may help them in different cases. Who wants to live with a burning hole in their stomach? Reduce the over-the-counter painkillers and wash your hands.